Today we are going to discuss a very important topic in pharmacology, that is rabbit eye experiment. And here we will see the effect of various drug in the rabbit eye. So let's start the experiment, or let's start the lecture. This is the figure of anatomical structure of the eye. So here we can see that this is the cornea part, this is sclera, this is iris, ciliary muscles and the ciliary epithelium, and this is the point from which the aqueous humor released and comes into the posterior chamber, and from the posterior chamber it comes into the anterior chamber, and through this junction it outflow occurs from the trabecular meshwork. The aqueous humor getting drained here and the outflow occurs. So here we can see the lens that is attached with the zonular ligament, and this is the optic nerve. This is the anterior chamber, this is the posterior chamber. What is important here, there are the presence of two muscles that are present in the iris here. One is the sphincter pupillae, other is the radial pupillae muscles. So what is important, suppose this is the sphincter pupillae muscles in the circular shape, and here this is the radial muscles, like this is the radial muscles. The important thing is the location of the receptors on both muscles. We have to know which receptors are present in which muscles. Like in the sphincter pupillae muscles, there is a presence of the M3 receptors, and in the radial muscles there is a presence of alpha 1 receptors, and we know both are the GPCR receptors. So the important thing is the activation of these both receptors and the effect of the outcome of these receptors after activation. So like M3, we know GPCR receptors are activated through G subunit, like the M3 receptors activated through the GQ subunit, that will cause the activation of the phospholipase C enzyme, that will lead to the phospholipase C enzyme lead to the activation of the IP3 DAG pathway. So this IP3 DAG pathway, when activated, it will cause release of the calcium through the activation or opening of the calcium channel. After this calcium, a combination with the calmodulin, and this calcium calmodulin will cause the activation or the contraction of the sphincter pupillae muscles. Contraction of the sphincter pupillae muscles. So when these sphincter pupillae muscles are contracted, they will cause, suppose these muscles if they contracted, they will try to come towards inward, and that will lead to the decrease in the size of pupil. That is, this phenomena is called meiosis. So the final result is meiosis. Whenever the M3 will activated through any drug or through light reflex, it will cause meiosis. Activation of the M3 receptor will cause the meiosis. One thing is that. Second thing, the activation of the alpha 1 receptor. Alpha 1 receptors are present in the radial muscles. Here we can see the radial muscles that are present in the iris. So whenever the alpha 1 cause activated, it will cause the activation of the same GQ subunit, and after that the activation of the GQ subunit, it will cause the activation of the again phospholipase C, and the remaining process is same as the M3 receptor. So the final outcome is the contraction. Remember, here the final outcome is also the contraction of the radial muscles. If the radial muscles are contracted, they will contracted like this. If the contraction occurs in the radial muscles, it will cause the movement of the muscles through the outward direction, and that will lead to the dilation of the pupil, not the contraction. Rather than the contraction, it will lead to the dilation of the pupil. Process is same, outcome is same, but the final outcome is different. It will lead to the mydriasis. So the contraction of the radial muscles will lead to the mydriasis. So whenever the M3 receptor is activated, it will lead to the meiosis, and whenever the alpha 1 receptor getting activated, it will lead to the mydriasis. The drugs act on the both receptors having the same action, but the effect will be different. Another thing, suppose if we block the M3 receptor, suppose if we block the same M3 receptors, and the drug, most common drug which causing the blockage in the M3 receptor, that is atropine. So what will be the effect of atropine? Like the drug which causes the activation of the M3 receptor that were causing the meiosis, and this time the drug like atropine which causes the blocking of the M3 receptor, it will cause the mydriasis, opposite action, mydriasis. Another important thing here, the presence of M3 receptors not only on the sphincter pupillae muscles, however, they are also present here in the ciliary muscles. Here in the ciliary muscles, M3 receptors also present. So, when the M3 receptors are present here, if the M3 receptors are here, then it will follow the same mechanism and it will lead to the contraction in the ciliary muscles, contraction in the ciliary muscles. Remember here one thing, whenever the ciliary muscles contracted, the contraction of the ciliary muscles cause the movement of this portion towards this direction. When the movement of the portion occurs in this direction, this place will be free or more wide, and that is the place where the trabecular meshwork is present. So whenever this portion going to this direction, it will cause the more widening of this portion, and that will lead to the more aqueous humor outflow, that will lead to the more aqueous humor outflow from this portion. Another thing, when this portion getting comes to this direction, it will cause the loosening of the these zonular ligaments. Whenever these zonular ligaments getting loose, that will cause the pressure on the lens and it will cause it more convex, and when it will lead to the more clear near object and it will cause the accommodation of the lens. Now let's come to the next slide. Here we can see the pupillary sphincter muscles. The presence of these N3 receptor will cause the contraction of these muscles that will lead to the meiosis, correct? And the receptor, the drug which can cause the blockage of that receptors M3 receptor will lead to the mydriasis, like the atropine drug, atropine. Second muscles was the radial muscles that are present in the iris, and the alpha receptors, alpha 1 was present there, and the contraction of that receptors will lead to the mydriasis rather than meiosis. It will lead to the mydriasis because of the outward direction movement of the muscles, and the relaxation means the blockage of the alpha 1 receptors that lead to the meiosis. Alpha 1 receptor blockers causes the meiosis. Ciliary muscles, I already told you that the M3 receptors are present also on the ciliary muscles, and they causing the contraction in the ciliary muscles because of the movement of the whole structure that will lead to the accommodation for near vision, more convexity in the lens. And the relaxation means the blocking of the M3 receptor will lead to the relaxation, and that will cause the focus for the far vision. Ciliary epithelium, mostly the beta receptor, and in the beta receptors mostly b2 types of receptors, beta 2 types of receptors are present, although some other receptors also present like the alpha receptors, mainly alpha 2 are present. So the activation of these receptors that are present in the ciliary epithelium, like beta 2, activation of beta 2 will lead to the secretion of the aqueous humor, and the blockade of the beta 2 will lead to the decreased aqueous humor production. So this is the flow chart of the aqueous humor outflow. Outflow occurs by two ways. One is the trabecular outflow. Most of the outflow occurs from here, like the 80% outflow, and the uveoscleral outflow, 20% outflow from this part occurs, and the aqueous humor goes to the superior ophthalmic vein, then from there the cavernous sinus. So let's take receptors one by one. For the production of the aqueous humor and the outflow of the aqueous humor, there are role of some receptors that are present in the eye. Like, one thing is the production of the aqueous humor. Remember, like this: A, B, C, M, R, P. So these three ABC, like the alpha receptors, beta receptors, and the carbonic anhydrase, that all are present in the ciliary epithelium. They all are present in the ciliary epithelium, and having, they all taking part in the production of the aqueous humor, like alpha receptors, beta receptors, and carbonic anhydrase, all taking part in the production of the ciliary epithelium. Like alpha 2, it will block the production of the aqueous humor from the ciliary epithelium. Beta receptors, beta 2, it will take part in the production of the aqueous humor by activation. And the carbonic anhydrase enzyme, it will causing the production of the aqueous humor. So beta receptors activation cause the activation or production of the aqueous humor, and the alpha 2 receptor will cause the decreased production of the aqueous humor. So if we can block the alpha 2 receptor, we can increase the aqueous humor production. Likewise here, if we block the carbonic anhydrase, that will decrease the production of the aqueous humor, because carbonic anhydrase taking part in the reaction that are important for production of the aqueous humors. Other three receptors, like M receptors, mostly M3 receptors, we already discussed, present in the ciliary sphincter pupillae muscles. Rho kinase, this is present in the trabecular meshwork mainly, and the prostaglandins, they also present in the trabecular meshwork and taking part in the increased outflow of the aqueous humor. So remember, these receptor ABC is present in the ciliary epithelium, MRP is present in the mainly trabecular meshwork and the right. Here alpha 2 and the beta 2, they both receptors also present in the trabecular meshwork, and also taking part in the aqueous humor outflow. So the alpha beta means alpha 2 and beta 2 also taking part in the aqueous humor production, and also it both receptor causing the outflow of the aqueous humor. So let's take one by one. Like alpha 1 receptors and alpha 2 receptor. Alpha 1 receptor is located in radial muscle of iris. these receptors are present in radial muscles of iris, and the phenomena is the activation of these receptors will cause the contraction in the radial muscles, and it will lead to the mydriasis. On the other part, alpha 2 are present in the ciliary epithelium, and alpha 2 is activated through the GI subunit. This is also GPCR receptor, and whenever the GI subunit activated, it will lead to the decrease cyclic AMP or decrease adenyl cyclase enzyme, that will lead to the closing of the calcium channels or decrease calcium. Whenever the calcium is decreases, it will lead to the decrease aqueous humor outflow, because it will lead to the decrease sodium potassium ATPase pump. It will lead to the decrease in the chloride channel, and it will lead to the decrease in the bicarbonate ion, and this all reactions are important in the formation of the aqueous humor. So the decrease in the calcium will lead to the decrease in all the process, and that will lead to the decrease in the aqueous humor formation. Aqueous humor production. One thing means the activation of the alpha 2 will lead to the decrease in the aqueous humor production, and whenever the aqueous humor production will decrease, the patient getting a relief in the glaucoma. So the drug which can cause the activation of the alpha 2 receptor, like the brimonidine, and this drug is the mainly act on the alpha 2 receptor brimonidine, and it will lead to the decrease in aqueous humor production. Second is the beta receptors. Two types of the beta receptors present in the eye, beta 1 and the beta 2, and mostly beta 2 are present in the ciliary epithelium. Beta 1 is also present, but most of the receptors are beta 2 type. So whenever the beta 2 activated, beta 2 is also GPCR receptor, and it will activate it through GS subunit, and it will lead to the activation of adenyl cyclase, and activation of this adenyl cyclase will lead to the activation of cyclic AMP, and that will lead to the increase in the calcium ion or the opening of the calcium ion channels, that will lead to the activation of all mechanisms, like the activation of sodium potassium ATPase pump, activation of the chloride channels, activation or the increase in the bicarbonate ion, and that will lead to the increased production of aqueous humor. So whenever beta activated, beta 1 or beta 2, this beta 1 is also activated through the GS subunit. Process or the mechanism will be the same. They both will lead to the activation or the production of the aqueous humor. So the drugs which blocks the beta 2 or the beta 1 receptors, that will cause the decrease in the production of the aqueous humor, and both blockers are indicated in patient of glaucoma, beta 1 and beta 2, like timolol. Timolol act on the both receptors, and it will lead to the decrease in the production of aqueous humor and lead to the relaxation or the relief in glaucoma. Third one is carbonic anhydrase. carbonic anhydrase. In the ciliary epithelium, the reaction occurs between the carbon dioxide and the water, H2O, that will lead to the formation of the carbonic acid. And this carbonic acid, with the presence of the carbonic anhydrase, getting converted into the hydrogen plus bicarbonate ion, and the formation of this bicarbonate ion will cause will lead to the activation of the sodium channels opening, and the sodium is getting out of the ciliary epithelium. And when sodium is getting out from the ciliary epithelium, the water is going with the sodium, and that will lead to the increased production of the aqueous humor. That will lead to the increased production of the aqueous humor. So if we block this enzyme from here, if we block that carbonic anhydrase enzyme, that will lead to the decreased production of the aqueous humor, and the drugs which causing the or the drugs which are called as the carbonic anhydrase inhibitors, they are acetazolamide, dorzolamide, brinzolamide. They are the drugs that causing the carbonic anhydrase inhibitor. Let's take the M3 receptors. We all know that the M3 receptors are present in the sphincter pupillae muscles, and it will lead to the contraction and the meiosis in the eye. Other side of the M3 receptor is the ciliary muscles and the contraction of these M3 receptors will lead to the movement of the whole structure, that will lead to the widening of the angle from which the trabecular outflow occurs, and it will also lead to the accommodation of the lens for the near vision because of the more convexity of the lens, accommodation of the lens. So if the ciliary muscles contracted or the M3 receptor activated, it will lead to the increased outflow, that is also causing the increased outflow of the aqueous humor. Now the rho kinase is present in the trabecular meshwork. This enzyme is present in the trabecular meshwork, and this enzyme activation will lead to the activation of the actin myosin or the fusion of the actin myosin, that will lead to the contraction, and if the contraction occurs in this area, that will lead to the decreased outflow of the aqueous humor. Means this area become more dense, and that will lead to the decreased outflow of aqueous humor. So if we relax this area by inhibiting this enzyme, we have to inhibit the rho kinase enzyme, and if we relax this area by inhibiting the rho kinase by the drug netarsudil, it will lead to the increased outflow. This drug will lead to the increased outflow, and that will be beneficial in the patient of the glaucoma. Other receptor is the prostaglandin, and we discussed that the prostaglandins GPCR receptors getting activated through the GQ protein, and whenever the GQ protein activated or the GQ subunit activated, it will lead to the activation of the phospholipase C enzyme, that will lead to the activation of the IP3 DAG pathway, right? After that, the IP3 DAG pathway, that will cause the opening of the calcium channels or increase in the calcium ions, and here this will lead to the activation of the matrix metalloprotein, and these matrix metalloprotein will lead to the degradation of the extracellular matrix. This extracellular matrix become degraded, and after degradation, extracellular protein like proteoglycan and fibronectin, these extracellular matrix material causing the increased density of this structure. So whenever the prostaglandins analogs are activated or the prostaglandin receptors are activated, they causing the degradation of these extracellular matrix, that will lead to the degradation of the extracellular matrix and causing increased outflow, means the area become less dense, and that will be helpful in the outflow of the aqueous humor. So the drugs which we are giving in the glaucoma are the prostaglandin analogs. We are giving the prostaglandin analogs like latanoprost and some other drugs. Another important thing that we have to understand here, the light reflex pathway. So when the light rays comes to our eye or comes to the eye of rabbit, it will comes to the optic nerve and going through the optic chiasm, then optic tract, and it will comes to the pretectal nucleus. From the pretectal nucleus, fibers is going on the both sides of the Edinger-Westphal nucleus, and a reflex generated through the short ciliary nerve and the effect on the F3 receptor that are present in the sphincter pupillae muscles. So if the light comes to the eye contact, it will cause the activation of the M3 receptor, and whenever the M3 receptor activated, we already know, whenever the M3 receptor activated, it will lead to the contraction of the sphincter pupillae, and the final outcome is meiosis. Whenever the M3 activated, the final outcome will be meiosis. So the anytime if the M3 receptors are activated, they will lead to the meiosis, unless the M3 receptors are blocked by some drug like the atropine. If we give the atropine, and that drug will lead to the blockade of the M3, that will not cause the meiosis, that will lead to the mydriasis because of the blocking of the M3 receptors. So atropine will lead to the mydriasis after light reflex. This is the corneal reflex pathway. Any touch on the cornea will lead to the activation of the ophthalmic branch of the trigeminal nerve. The signal goes to the spinal nucleus of the trigeminal nerve, and then it goes to the both sides facial motor nucleus, and the outcome as a motor reflex is generated in the orbicularis oculi muscles. So if the signal is going to the both side of nucleus, that will lead to the blinking of the both eyelids. That reaction is not occurs in the rabbit, because in rabbit the signal is not going to both side. Like in the light reflex, in rabbit from the p-tactile nucleus, the signal is not going to the both side. It goes to the single side or the ipsilateral side of the Edinger-Westphal nucleus. That's why if we put the light on the one eye, it will not lead to the meiosis in the other eye. That's why the rabbit is good for this experiment, this type of experiment. So the aim of this rabbit eye experiment, we have to calculate the pupil size after various drug, light reflex, corneal reflex, and the intraocular tension. Materials we need: rabbit, of course, rabbit holder, measuring scale, doppers for putting the drug in the eye, torch, cotton wool, and scissor. The drugs we can use: the physostigmine, normal saline in the control eye, the atropine, ephedrine, adrenaline, lignocaine, phenylephrine, and the pilocarpine. We have to look for the meiosis, mydriasis, different reflexes, and the mechanisms involved. Let's take one by one. This is the software in which we can see the effect of various drugs in the pupil size, the light reflex, and the corneal reflex. So here first we have to select the drug. Here we can see, we can measure the pupil eye from here. This is the portion for the drug which we are going to insert. There is a separate eye, I1 and I2. This is for the torch or the light reflex. We have to touch with the cotton for the corneal reflex, and this is the intraocular tension. We have to look here also. Let's start. And this is the light reflex. If we give the light reflex, look here, this is the pupil size, and if we give the light reflex, the pupil is getting decreased. There is no change in the intraocular tension. If we just put the light reflex, the pupil size is getting decreased. How? When we put the light reflex, the receptors that are activated are the M3 receptors. Whenever the M3 receptors getting activated, what will happen? It will present in the sphincter pupillae muscles, and that will cause the contraction. We already know activation of these receptors will lead to the contraction, and the final outcome will be the meiosis through the light reflex. No need of any drug, only through the light reflex, because light is activating the M3 receptors, and the activation of the M3 receptor will lead to the contraction, and that will lead to the meiosis here. Next, if we put the cotton on the cornea, that will cause the blinking of the eyelid. How it is possible? If we touch the cornea, that will activated the trigeminal nerve, and the reflex goes to the facial nerve, and that will lead to the motor reflex by the activation of the sodium channels present in the orbicular oculine muscle. Sodium channel, whenever the sodium channel activated, that will lead to the depolarization, contraction in the muscles. So through the activation of the sodium channel, that will lead to the contraction of the muscles, that will lead to the corneal reflex. So here the corneal reflex positive after touch with the cotton wool. Come to the next slide. So we are going to give the drug epinephrine. That is very difficult part, because epinephrine act on the various receptors. And which receptors epinephrine act? We know: alpha 1, alpha 2, beta 1, beta 2. So we know the basic things. Alpha 1 is present on the radial muscles. Alpha 1 is present on the radial muscles, and the activation of the alpha 1 will lead to the mydriasis. The activation of these receptors will lead to the mydriasis. Correct. Alpha 2 are present in the ciliary epithelium and in the trabecular meshwork. both places. And what is the function of the alpha 2? It will activate GI subunit and causing the decrease in the production of the aqueous humor. From the trabecular meshwork, it will lead to the decrease in the outflow also. Because of the decrease in the calcium ion, that will lead to the decrease in the outflow of the aqueous humor. So it will lead to the decrease in the aqueous humor production, and it will lead to the decrease in the outflow. What about the beta 1? Beta 1 is present in the ciliary epithelium in the less amount. Most abundant among the beta 2 is present on the ciliary epithelium, and it will lead to the activation of the GS subunit. From the GS subunit, it will lead to the increased production of the aqueous humor. And the beta 2 is also present in the trabecular meshwork, and from the trabecular meshwork it will lead to the increased outflow. Because of the activation of the calcium channel, it will lead to the increased outflow of the aqueous humor. So the beta will increase the production of the aqueous humor, it will also increase the outflow. Alpha will decrease the production of the aqueous humor, and it will decrease the outflow also. The main thing here this predominates is from the alpha 2. So the production is increased and the outflow is also increased, and the outflow is decreased. This mechanism will be nullified, and here beta 2 will cause the increase in production of the aqueous humor, but not so much. The action of the alpha 2 is predominate after giving the epinephrine, and because the alpha 2 causing the decrease in the aqueous humor production, so it will lead to decrease in the intraocular pressure. If the intraocular pressure getting decreased, so this intraocular tension will have to be decreased. What about the light reflex? Here remember one thing, we are not touching the M3 receptors. So we are not doing anything on the M3 receptors that are present in the sphincter pupillae muscles. Whenever the light will come, it will cause the contraction or the meiosis of the pupil. Here we can see two things. One is the dilation of the pupil because of the alpha 1 activation. One is the decrease in the intraocular pressure. Let's come to the next slide. Like this, mydriasis and decrease intraocular pressure. After giving the epinephrine, we will see the two outcomes. One is the mydriasis, other is the decrease intraocular pressure, right? Next thing, in the second eye also the same mechanism, and the same intraocular pressure decreases. Here we can see that light reflex. Look here, this pupil is dilated. If we give the light, it will cause the meiosis because of the activation of the M3 receptor. It will cause the meiosis because epinephrine does not act on the M3 receptors. M3 receptors are free. So if we give the light reflex or the light, it will cause the reflex of meiosis. Likewise, in the touch reflex, for the activation of the touch or the blocking of the touch, we have to block the sodium channels that are present, because reflex will be positive. Because if we touch the cornea, it will cause the reflex and activation of the sodium channel. So the sodium channel getting activated and cause the depolarization, and as a reflex we will see the blinking of the eye. So here we can see after giving the atropine, first is pupil size increases, mydriasis, intraocular tension decreases, light reflex present, and the corneal reflex present. Now another drug, that is atropine. Now look the effect of the atropine on the pupil size, intraocular tension, light reflex, and the corneal reflex. We already know the effect of the atropine occurs by the blocking of the M3 receptors, and M3 receptors are present in the sphincter pupillae muscles, and that is also present in the, and that will cause the paralysis of the blocking of the M3 receptor, causing the paralysis of the ciliary muscles. That phenomena is known as the cycloplagia. This phenomena is known as the cycloplagia. Another important thing, here we are blocking the M3 receptors, that are the main key receptors for reflecting the light. If we block these M3 receptor, the light reflex will be absent. There will be no light reflex after blocking the M3 receptors. So let's take one by one. The result will be here the mydriasis. There will be no effect on the intraocular tension because the alpha and beta receptors are not taking part here. Take one by one. So here we can see the mydriasis because of the blocking of the M3 receptors. Here we cannot see any changes in the intraocular tension because of the no role of the alpha and beta receptors. Like here we can see both eye dilated and light reflex. There are no meiosis, no effect of the light because of the blocking of the M3 receptors. But the corneal reflex is present because there is no involvement of the sodium channels that are present in the orbicularis oculi muscles. So this is the phenomena, this is the action of the atropine in the rabbit eye experiment. Atropine causing increased pupil size, that is mydriasis. This drug not causing any change in the intraocular tension. Light reflex will be absent because of the blocking of the M3 receptors, and the corneal reflex will be present because of the no role of the sodium channels, and the sodium channels are still activated. Now the next drug is ephedrine. What is more important about the ephedrine? Ephedrine acts on receptors alpha 1, alpha 2, beta 1. This drug causing release of the non-adrenaline from the presynaptic neurons. This drug causing activation or the release of the non-adrenaline from the presynaptic neurons. So from releasing of non-adrenaline, we all know that the non-adrenaline act on the alpha 1 receptors, alpha 2 receptors, and the beta 1 receptors. So let's take one by one. If we give the ephedrine, it will cause the release of the non-adrenaline, and it will cause the slow release of the non-adrenaline from the presynaptic neurons, and the non-adrenaline will act on the alpha 1 receptor, alpha 2 receptor, and beta 1 receptor. There is no role of beta 2 here. So the alpha 1 receptors, we all know alpha 1 receptor causing mydriasis through the radial muscles that are present in the iris, mydriasis. And activation of the alpha 2 receptors, again it will cause the activation of GI subunit, that will cause decrease in the calcium ions, that will cause decrease in the intraocular pressure or the aqueous humor production, decrease in the aqueous humor production. and the beta is present on both places, ciliary epithelium and the trabecular meshwork. So from ciliary epithelium it will cause increase in the aqueous humor, and from the trabecular meshwork it will cause increase in the aqueous outflow. But in the case of ephedrine, it will cause the release of the non-adrenaline that will releasing from the presynaptic neurons very slowly. So this effect will not come. Or when increase aqueous humor and increase outflow of the aqueous humor, so this effect is not so dominant, and the effect of the alpha 2 will not become because of the slow release of the non-adrenaline of the presynaptic from the presynaptic neuron. So there will be no effect on the intraocular pressure after giving the ephedrine. Like here we can see, after giving the ephedrine, dilation of the pupil because of the alpha 1 receptor, but there is no effect on the intraocular tension. No effect on the intraocular tension. Second eye also because of the alpha 1 receptors that are present in the dilator muscles, but no effect on the intraocular tension. Light reflex. What about the light reflex? Light reflex is present because of the activation of the M3 receptors. Light causing the activation of the M3 receptors. So here the light reflex is present and it will lead to the meiosis. Corneal reflex also present because there is no blocking of the sodium channels and the activation of. So here we can see pupil size is increased, mydriasis, no effect or no significant change in the intraocular tension. Light reflex present because of the M3 receptors, and corneal reflex is also present because of the sodium channel opening. Next drug is physostigmine. We all know that the physostigmine is acetylcholinesterase inhibitors, lead to the increased amount of the acetylcholine in the synaptic cleft. So if the acetylcholine is increased, if acetylcholine is increased, that will act like the drug acetylcholine. It will affect all muscarinic receptors, and the receptor that is present in the eye is M3. If we activate the M3, it will lead to the meiosis because M3 is receptors are present in the sphincter pupillae muscles, that will lead to the meiosis. Other M3 is also present in the ciliary muscles. In the ciliary muscles, they causing the shifting or the contraction of the muscles that will lead to the increased outflow. So if the outflow is increased, that will lead to the intraocular tension because of the outflow is increased. So here we can see, as a result, after giving the physostigmine, it will activate the M3 receptors and it will also cause increased outflow. So here we can see both pupil is decreased, meiosis occurs because of the M3 receptors. M3 activation will lead to the meiosis. Another thing, because of the M3 activation in the ciliary muscle, that will lead to the contraction and the ciliary muscles and lead to the increased outflow, that will lead to the decrease intraocular tension. What about the light reflex? Light reflex is present because we are now activating the M3 receptors, and the M3 receptors are present in sphincter pupillae muscles that are getting activated and cause the light reflex, that is lead to the even more meiosis. And what about the corneal touch? Yes, it should also be present because of no blocking of the sodium channels. If the sodium channels are free, they are going to be activated after touch, and it will lead to the corneal reflex. So the final result will be there will be meiosis because of the activation of the M3 receptors. Intraocular tension decrease because of increased outflow. Light reflex will be present because of activation of the M3 receptors, and the corneal reflex will also be present. Now the last drug is the lignocaine. We all know this is the local anesthesia, and it will cause the blockage of the sodium channel in the inactivated state. Lignocaine causing the blockage of the sodium channel in the inactivated state. You all know that the sodium channel is present in the three states. So blockage of the sodium channel will lead no corneal reflex. Here there will be no effect on the eye after giving the lignocaine because no role of the M3 receptors. There will be no effect on the intraocular tension because lignocaine not causing activation or inactivation of the alpha and beta receptors, but there will be presence of the light reflex because light will activate itself the M3 receptors, and that will lead to the meiosis. It will cause the blockage of the sodium channels that will lead to the absent corneal reflex. Let's take one by one. If we put the lignocaine, here we can see no effect on the pupil, no effect on the intraocular tension. In I2 also no effect, but light reflex is present because the M3 receptors are still activated through the light. So it will cause meiosis. Now corneal reflex absent because the blocking of the sodium channels. The final effect after giving the lignocaine, no change in the pupil size, correct? No change in the intraocular tension, but the light reflex present because of the M3 receptor activation through the light, and corneal reflex absent because of the sodium channel blocking. This is all about the rabbit eye experiment. Hope you are understand.